colleague, Dr. Zhanna Pinkus.
Hi.
Hi. We're going to get on screen in a moment. A little background about Dr. Pinkus. She's a board-certified obstetrician and gynecologist. She practiced for about 11 years in Torrance before she moved to back to Newport Beach to work with Dr. Kroll at Newport Center Women's Health. This was back in 2017 when I first got to meet Dr. Pinkus.
Yeah.
I was lucky enough to find her when she was settling, and she actually worked with a colleague of mine from Stanford. So I grabbed her as soon as I met her to be my OB for my second born. Lucky for me.
Awesome.
Dr. Pinkus has a beautiful bedside manner for my fragile adolescents going through puberty, and that's why I have her here today to speak about some of the adolescent pain syndromes and her expertise. You can find more on Dr. Pinkus and her many accomplishments. She studied at Albany Medical College and then Kaiser Sunset Medical Center. You can learn more about her hiking passions and the like at newportcenterwomenshealth.com. I will add that in the comments. So let's get our talk underway and we can meet Dr. Pinkus.
Thank you so much, Vivi, for that introduction. I do want to clarify for everybody that I'm an adult gynecologist, but as I kept on practicing, the mamas would bring in their daughters, and so I started to see a lot of adolescents, and it's such a neat place to be. And as a mom of a 10, almost 11-year-old, I really can see how exciting and interesting it is to really help a young woman get to know her body and address any issues she might have, of course, with her pediatrician. But if something becomes a little bit more intense and uncomfortable, it's nice for them to be able to see us in kind of a subspecialty setting. So, menstrual disorders are so common in adults, but they're actually super common in children. And of course, as being something that is new to them, I think that that is a very special opportunity for the pediatrician, of course, to address those issues. Um, by the time they see me, their pain disorders are usually quite severe. And so one of the things I do want to talk about is when is it so severe that they need help, right? Like, when do I take my daughter to the doctor because she's so debilitated? And I think all parents and pediatricians are so careful in asking their kids about how they're feeling. And I say kids, but sometimes they're 16-year-olds, so they're not little tiny kids. And they will address to you, I can't go to school today, Mom. My stomach hurts so badly. I just can't. I can't handle it. So I think as a parent or as a pediatrician, I think the amount of concerns that your child brings up definitely rings the bell as to when they might need subspecialty care. If there's a lot of school days that the child is missing from the pain, I think that is a huge indicator that, gosh, maybe something else is going on, and maybe I need to send this child to a gynecologist to get a little bit more help. In terms of the kind of pain kids get, sometimes it's tricky to even understand the details. Sometimes it's pain during their period, sometimes it's pain before their period. And they'll often describe it as crampy, but sometimes it's back pain. It's different in different kiddos. And I think as a parent and as a doctor, we always pay so much attention to our kids' pains, and we're not usually there to rush into it without being concerned and thoughtful and maybe trying a heating pad, trying conservative measures. But once you get somebody, Vivi, right, that's so uncomfortable, they're calling you all the time. What do I do? My daughter is suffering. The pain is so intense. And maybe you try a little low dose Motrin or Tylenol or heating pad, or even a calcium supplement as a muscle relaxant can help them. Once you've tried these strategies and remedies, and they have not worked enough, then probably that would be the time for them to see us. And when I see a patient with pain, an adolescent patient with pain,